Happy to have with us here at ASCO 2012 Dr. Vojo Vukovic, the Chief Medical Officer at Synta. Doctor, thanks for being back.
Thank you for having me here.
Last year you sat here with a great deal of excitement and enthusiasm. Where do you sit this year?
If anything, I feel even more enthusiastic and more optimistic this year compared to last year. And the reason for that is really the progress that you've achieved with our Ganetespib program in the clinic. Last year, Dr. Shapiro and I talked briefly about some results in lung cancer, where we used Ganetespib as monotherapy for treatment of patients who have exhausted other treatment options for lung cancer. This year, we're seeing early encouraging data from another study where we actually combined Ganetespib with a standard of care drug aimed at improving the results in those patients who are treated with the standard of care drug docetaxel.
What are your development plans for this compound?
Last year we presented single agent data, meaning that we have identified certain patient subpopulations where the drug as single agent could achieve efficacy and help those patients. This year we're broadening our development program because we are combining the drug with standard of care drugs so that we can address the unmet medical needs of a much broader patient population.
What are your opinions of the data being presented here with it at ASCO?
Here at ASCO for Ganetespib, we're presenting several data sets, two in the preclinic, which really address two things. One is an interesting safety profile advantage that I think our drug has relative to some other drugs in this class. Other HSP90 inhibitors have reported last year ocular toxicity, which is a serious impediment for those drugs. We have now shown, both in the clinic and preclinically, that our drug doesn't have that type of toxicity. So that's one presentation that's coming up in 2 days. The other data set is really some very encouraging data about Ganetespib monotherapy in patients who have ALK-positive non-small cell lung cancer. That's one of these genetically profiled patient populations where Ganetespib has excellent single-agent activity. So we think that our drug could present really a great opportunity for those patients.
Really good news for them.
That's really, so that's why I said in the beginning, if anything, I'm actually more optimistic compared to last year because we have now seen broader activity and broader applicability of the drug for the treatment of patients with lung cancer.
Well, we'll have you back next year, and hopefully we'll have even more good news to share.
Thank you very much.
Doctor, thanks for being with us. Dr. Vojo Vukovic, he is the Chief Medical Officer at Synta.